This is a continuation of our PolicyCast, and this again on healthcare, since that's been such a major piece of legislation, a major issue in this Congress. Well, the thrust of this legislation with regard to reining in healthcare costs and reducing the deficit is that we try to put in new payment procedures and new payment models in Medicare. Medicare, of course, is the biggest purchaser of healthcare services in the country. And so if we can change the way Medicare purchases healthcare services, then we believe that will carry on into the private sector as well. So what we're doing is we have provisions for bundling of services, for example. Instead of paying physicians and hospitals for each procedure that's performed on a person when they go in with some illness, we're trying to pay them for the treatment of that illness as a package, and say to the extent that the hospital and the physicians involved and others can save funds and can get that person well and through that illness episode more quickly, then they will be able to make money from that, and Medicare will be able to save funds also as part of that process. So we also are cutting back on the amount of subsidy under Medicare Advantage. That's been a big item in the that has driven up the cost of Medicare more than it needed to be driven up. So we're doing that as well, and we hope that all of that together, the Congressional Budget Office assures us that those provisions taken together will in fact reduce the size of the federal deficit in future years. Well, the truth is this health care reform legislation did not change the reimbursement law with regard to physicians under Medicare, the so-called doc fix, which is something that Congress has engaged in nearly every year here since 1997, when the Budget Act put in place unrealistic requirements with regard to reducing Medicare reimbursement. That still has to be done. We tried to do that last year. We didn't have the necessary votes to get it done, and we are going to try again very hard to get it done this year, so that that continued need to waive the Budget Act in order to maintain current levels of reimbursement for physicians would be eliminated. Thank you again for watching. These questions were ones which various folks sent to us. If you have additional questions about this new health care bill that you would like us to respond to, please email us to that effect, and we will try to get a response in our next update, our next podcast on this issue. Thank you.